So, ladies and gentlemen, something unprecedented just happened in Burkina Faso, and I need you to understand exactly what this means, okay? Captain Ibrahim Traore has just brought together over 1,000 traditional abelisks in a single national offensive initiative. Because everything related to Burkina Faso right now has one word attached to it: offensive initiative. According to the information, this was not a symposium, not a cultural festival. Ladies and gentlemen, this is a deliberate state-backed effort to formally integrate traditional African medicine into the country's healthcare system. And I'm not really messing about when I talk about this, ladies and gentlemen. And I think this might be one of the most significant cultural pivots on the continent of Africa right now. Because come to think of it, where have you seen phytotradomedical initiative being incorporated into modern pharmacology? Ladies and gentlemen, Captain Ibrahim Traore understands what the historical heritage of Africa is, and he's trying to incorporate the traditional and the Western medicine together, try to stable the ship a little bit and see where the balance is. And in this current time, our traditional medical practitioners, they no longer treat blindly. Now they go for the therapeutic dose and they go for the pharmacological toxic dose. Now we have to understand this. Our traditional medical experts don't only just look for this. They are now going for nephropathic diagnosis, and they are checking for hepatocellular pathologies in patients even before they treat. Ladies and gentlemen, African traditional medical experts are no longer in the Stone Age. And ladies and gentlemen, that is why I think that this might be the most significant cultural pivots on the continent of Africa right now. Hold on a minute, I'm not done, because this is where it matters beyond the headline. According to the information from Burkina Faso's Ministry of Health, more than 80% of the population already relies on traditional pharmacopoeia for their primary health care. Now let us sink in. They rely, more than 80% of Burkinabe, they rely on the tradomedicals. It is because they know that it is proven, it is tested, and when it comes to African medicine, and based on the way their body physiology respond to this traditional medicine, they have seen that it truly works. If you're going with me statistically, this means that 4 out of every 5 Burkinabe depends on tradomedicals. Now, and yet for decades, traditional medicine was pushed to the margins. Now, it was a thing you did, when you couldn't afford the hospital care, and it was dismissed as unscientific, unregulated, unreliable. They were talking about the toxic and the therapeutic dose and all of that. Now the colonial legacy, ladies and gentlemen, treated Africa indigenous knowledge as backwards, as in the Stone Age. And Traore is saying no more, no more. Ladies and gentlemen, and to me, I feel like if you truly want to own sovereignty, you have to be able to test it out on so many levels for you to know what works and what does not work. Now, do you know what we've equally found out? That sometimes with all the medical care, all the hyperkalemia regulation, insulin for diabetic patients, at some point, the body physiology stopped responding to the Western medical products. Let me tell you a story. When I was a kid, my mom told me that I had certain issues. And when she went to the hospital, the nurse at the maternity literally told her, "Go home. There's nothing we can do to this kid." Now, I do understand that at the time when I was born, medicine in Nigeria wasn't really so, on that level. They told my mom, "Go home." And my mom said she was frustrated and she was crying. And there was a traditional expert in the field of phytochemicals. They call her Iyasuli. And Iyasuli called my mom and asked my mom, "Why are you crying?" And my mom told her, "I went to the hospital. The head of my son is not forming right. And I went to the hospital and they said there's nothing they can do about it. That I should just probably use hot water and towel to touch my son's head for a couple of days, and if he survive, that means God wants him to live. If he pass away, is expected." And according to what my mom told me, Iyasuli took me from my mom and told my mom to give her 2 hours. She went to the forest to plug leaves. These are medical knowledge, traditional medical knowledge that have been passed from ancestors to ancestors, just like the fine wine, well seasoned. And my mom said she baited me with this herb, and my temperature that was up there to the point where I was convulsing, everything stopped. And she told my mom, "Bring this son of yours for 4 more sessions." My mom told me that after she took me to her, before the 4th session, I was already fine. And my head was already coming to shape. Like it wasn't moving like it was. Now, I really cannot explain the pharmacology behind the anatomical restructuring, but I can tell you it works. Probably she might have the best explanation from what just happened, but I can't give you the pharmacology and the relationship with the physiology. Now, what does this actually look like on the ground in Burkina Faso? Ladies and gentlemen, the National Federation of Traditional Medical Practitioners, FENATRAB, now brings together over 33,000 practitioners across the country of Burkina Faso. And in April this year, they achieved something remarkable. 53 traditional remedies for malaria, hypertension, diabetes, stomach condition. Let me take your time a little bit. Are you aware that if you break the stalk of the bitter leaf, if you break the stalk from the trunk, and you're having a sort of stomach upset, if you have peptic ulcer, and you chew it, do you know that research figured it out that the stomach upset is going to disappear? Now, I have eaten this before because I'm an ulcer patient, and I saw that the pain subsided, but I didn't stay long enough to know the duration. But this simply means that traditional medicine works. Now, these particular remedies in Burkina Faso were officially approved and listed in the National Medical Registry. Officially, these are not backyard brews anymore. They have been scientifically validated, standardized, and certified by the government of Burkina Faso, by the agencies that control, that monitor, that regulate how tradomedicals are being distributed in Burkina Faso and administered. And what do you think about all of this together, ladies and gentlemen? Political will. Captain Ibrahim Traore personally instructed the creation of a medicinal grove in each of Burkina Faso 45 provinces. Now, the idea is simple, but revolutionary. Grow the plants locally, process them locally, treat the patient locally, reduce dependence on imported pharmaceuticals that drain foreign reserve. Now, let's come to think of this. Remember the last time that Donald Trump said the United States was not prepared to fund the HIV initiative again? Ladies and gentlemen, did you notice the level of panic that reverberated across the continent of Africa? And in some geopolitical location in the continent of Africa where the epidemic was so massive. I sat down at the time and I was thinking, okay, so if Donald Trump stopped funding the HIV medical management initiative, what happens? A lot of people are just going to die. And ladies and gentlemen, these are the pit holes in the global geopolitics that Traore has seen. And Traore is creating a stitching time to make sure that the nation of Burkina Faso is not over-reliant. It's not given some of those Western oligarchs, do you know what I mean, the leverage they need to undermine the sovereignty of Burkina Faso as a great Pan-African state. The funny aspect of this whole thing, you see, in December 2025, Traore launched the medicinal plant in Guiba, dedicated site for cultivating endangered medicinal species. A 3-hectare grove already exists in the green belt of Ouagadougou, serving as a sanctuary for plants threatened with extinction, probably due to, weather condition and all of those things, climate change. But here's where it gets serious, families. These remedies are now being integrated into the formal healthcare system of Burkina Faso. The government's ambitious plan to build 55 new medical centers across the country includes provision for traditional medicine wings. In emergencies, health districts are instructed to contact local traditional medical practitioners association. This is not a parallel medicinal network in Burkina Faso. This is an integrated layer of new medical development, a revival of African-owned true medicinal therapy. Now, ladies and gentlemen, I need you to see the bigger picture because that really matters. This is not about some social media, ideology. It's about the reclamation, about the cultural rediscovery. All right? Think about it. The same administration that banned colonial era us air wigs, now they restored the ancient Faso Bukawi system of restorative justice. And now, traditional African medicine regulated, respected, and integrated into the national healthcare system. Why are they doing this? Because sovereignty, real sovereignty, is not just about who holds the guns. It's about who controls the knowledge, who defines what is legitimate, who decides what medicine looks like. For over a century, the West told Africa that its healing traditions were primitive, they were outdated, they were diabolic in some situations. Traore is telling a different story. Ladies and gentlemen, that's where it all matters. So what does this signal for the rest of the continent of Africa? I think this sends a clear message. The Sahel states are not just decolonizing the security architecture of Africa by confronting the insurgents head on and winning the battle on the line of contact. They are decolonizing the minds, their institution, their approach to healthcare. Burkina Faso is positioning itself as a leader in the promotion of African traditional pharmacopoeia. And if this integration succeeds, ladies and gentlemen, if those 53 approved remedies prove effective at a scale, you can expect other African nations to follow. Remember, Traore broke diplomatic ties with certain countries, and the moment he did that, and some countries saw the effectiveness, and they discovered that this was not Burkina Faso isolating herself, because after the diplomatic break, 8 different countries came to build synergy with Burkina Faso from a diplomatic standpoint. Burkina Faso is saying something very loud and clear. That we will do what we feel is fit for our own people, based on our own reality. There is a thing called tropical medicine. There's a thing called Caucasian medicine. There's a thing called traditional medicine. How about African medicine, ladies and gentlemen? Is this the genuine cultural reclamation? Or is it pragmatism driven by limited resources? Let me know in the comment section what you think. If you enjoyed this video, kindly do well to hit the like, share, and subscribe button, because if you don't, you definitely know that Android will cry. And if you're feeling generous, you can leave a comment in the comment section for us below. Ladies and gentlemen, this is the Android community, and I will see you on the next one, family. Stay blessed, and I want to appreciate everybody that everybody that wished me all the best for my wedding ceremony. It felt like you guys were all with me. I felt so confident. It was to me practically the most beautiful moment of my life, and it happened at a monumental period. Ladies and gentlemen, you all mean the best to me, and I want to appreciate Mary Netta. Ladies and gentlemen, Mary Netta, man, you're a special one, brother. By design, everybody on the Android community, man. By design, you are really, really a big cause. Like, you did something that blew my mind completely. The fact that you paid so much attention, that you kept me very close to your heart, and you paid attention to what was going on in my life, that you were so retrospective of what I said about me having a wedding ceremony on a certain date, and the love you showed, man, you are the real big cause, man. So, ladies and gentlemen, I want to thank you all. It's your boy 72 Andre signing out and all set. But before I go, do well to hit the like, share, and subscribe button. Don't forget, because if you don't, Andre will cry.